Baldy the Eagle, the tale of an American icon. Our story begins with Coco. It was 9 a.m. and her master, Dr. Epstein, had still not returned home from his emergency shift. Coco was lonely and decided to drink away her anxiety. She started with some fine red wine. Then she moved on to beer. After this early morning self-medication, Coco decided to go for a dip in the lake. With the help of her liquid courage, Coco took on a bald eagle. Coco meant to be playful, but unfortunately, she injured the eagle. Luckily, there was a crazy bird lady nearby, who immediately took the eagle to the VMTH. And now, the story unfolds.
Dr. 1B1A, we have a 4.5 kilogram adult bald eagle that is presenting to us today because it can't fly after being attacked by Dr. Epstein's dog, Coco.
Oh no.
Oh yes. So it is bright, alert, responsive, in good body condition, 3 out of 5. Good hydration, but it cannot weight bear on its right hind limb. So I think we need to do more diagnostics.
Definitely. Okay. So based on your physical exam findings, what would you like to do next?
Well, I did escort a very strong heartbeat, but I think that is related to the amount of pain the animal is in and the fact that it's really stressed out. It's a wild animal. So I would like to anesthetize the bird prior to any more noxious procedures to reduce pain as well as stress.
I think that's an excellent plan. What sort of pain responses did you see in our patient?
Well, at first, I assessed pain from far away because the animal was so stressed out. And it definitely has reluctance to bear weight on the right hind limb. It's also guarding this limb. It doesn't want us near it. It's very fluffed feathers, which I think is a stress response for birds. There's open mouth breathing and like a panting. So I think that also is a stress response. And the heavy eyelids, like a squinting appearance. So when I did my physical exam and was able to get close to the animal and palpate, it definitely screeched when I palpated the right hind limb, and it has a decreased range of motion and stiffness in that leg as well. I definitely think this animal is in pain.
All right. What sort of pain medication do you think we can use? You don't know? Well, let's go ask the anesthetist and see what she wants to do, all right?
Okay, sounds great.
Dr. Alex.
Hello, mates.
Hi. So we have a bird, a bald eagle, 4.5 kilo bird, who may have an apparent fracture in one of his limbs, and we need to double check with you to see what kind of pain medication you would recommend in our patient.
Well, for a bald eagle with acute pain, I would suggest butorphanol. Birds have increased kappa receptors, and this medication is IV. Now, if he gets a little frisky on us, I would suggest an alpha-2 adrenergic agonist such as metadomidine.
All right.
If we go to surgery soon, then I would suggest no intraoperative pain medication. Post-surgically, I would add another dose of butorphanol, and then we can put him on meloxicam and keep him on that for 10 to 12 days so he can recover.
Perfect. And then we should probably put him on fluids too, right?
Yes, that sounds great.
All right.
See you guys.
All right, thank you.
Good night, little mate.
All right, guys, let's get his blood drawn. Then we'll take him down to radiology, and then we'll have Dr. Vernau take a look at his blood, and we'll see what goes on.
So, what we have here, my little chihuahuas, is a complete closed fracture of the right tibia tarsus. It is a transverse fracture. As you can see, it is displaced medially, proximally, and over here, just a smidgen caudally. It makes sense that there is a transverse fracture in this case, because this injury was caused by tension, as Coco, Dr. Epstein's dog, pulled on the bald eagle's leg.
I can see it now, Dr. Johnson! Coco must have launched herself at at the bird, grabbing onto its right leg, and the tension of the bird trying to fly upwards and Kobo's weight pulling it downwards must have fractured the leg, leading to the transverse fracture. Is that right?
You totally got it spot on.
Yes!
Lymphomaniac, lymphomaniac on the floor.
Excuse me, Dr. Verneau?
Yes.
Hi, sorry to bother you. I wanted to check with you actually about some blood results. We had a bald eagle come in who's injured in the hospital right now, unfortunately. So we're interested in taking it to surgery, and I just wanted to run these results by you to make sure everything looks okay to continue.
All right. So I'm seeing a pretty classic inflammatory leukogram here. Jess, did you notice anything on the chemistry panel?
Actually, Dr. V, it's funny you should mention that because I have never in my entire veterinary student career seen a CK level as high as this at 8,400. That is just ridiculous.
Well, now, never say never, and always avoid always. I would say this is only moderate elevation of CK. It can get pretty high. Did you notice anything else?
Okay, good to know. Let's see, I also thought that the AST level looked a little bit high and the phosphate was also elevated.
Right. So what would be your top differential for those results?
Well, I think we've learned that AST can be elevated with damage to liver cells, but also in cases of muscle damage as well. So I think maybe one or the other could be the case here.
Okay.
You know, maybe since this bird had some trauma, it could be an indicator of muscle damage with the CK level so elevated.
I would agree with that.
Okay.
So would you say this bird is stable to go ahead with surgery and continued anesthesia?
I would say so. Is that
I would agree.
okay? All right. Thanks, Dr. V. Thank you.
Mm-hmm.
All right.
Do-de-do.
So, Dr. 1B1A, what are some surgical options that we can consider for this bird, and what are some of the factors specific to this patient that we have to consider?
Well, since our bird is a wild raptor, our goal is to be able to release it. So we need to be able to maintain maximum functionality after we've fixed the fracture, which means that our goal is to maintain pretty much primary bone healing as much as possible. There's three big options as far as fixing fractures. One of them is external coaptation, one is internal fixation, one is external fixation. External coaptation is pretty much the primary use of slings, bandages, and splints. And the thing about that, though, is even though it's very uninvasive, in order to fix this fracture on the tibiotarsus, we would need to pretty much have a splint ranging across multiple joints, and that would run the risk of ankylosis afterwards while he's recuperating, and so that would pretty much mean that he would have very limited mobility afterwards, and he would run the risk of not being able to survive in the wild, and so that's probably going to be a last resort option for us.
Right, so external coaptation would probably not be the best option for a patient. Next, we have the external fixation, which is when we put the pins through the bone, and then we stabilize it on the other side with a plate. And this would actually be perfect for our patient because we need him to return to function 100%. And so this would promote biological healing. It would prevent rotational bending and shearing forces. And it would just be very good for stabilizing the fracture. But I don't think that he would tolerate the external fixator very well.
Probably not. He is a wild bird.
Yeah, so might not be the best option.
Yeah. So I think we're kind of left with internal fixation here. We could probably do an intramedullary pin. Generally, with these larger birds, intramedullary pins tend to work really, really well, and we can fix it with circlage wires. We could also potentially use bone plating. Since this is a pretty simple fracture, we could just use a compression plating just to bridge the fracture there. But I think we should try to use the intramedullary pin and then kind of go from there.
Okay, that sounds good. think we've scrubbed long enough. Let's go put in that pin.
Alright.
As you can see from the post-op radiographs, many techniques were used to surgically repair the fracture. An intramedullary pin was used to internally stabilize the tibiotarsus and counteract bending forces, but we found that this was not enough. Therefore, a dynamic compression plate of the same metal type was placed medially on the right tibiotarsus, extending from the proximal metaphysis to the mid-diaphysis to form a buttress-like support of the bone, an intramedullary pin. After tightening the screws, we noticed lateral fissures running down the tibiotarsus. So to ensure that this bone was not going anywhere, we wrapped 2 cerclage wires, one proximal to the fracture and the other at the level of the fracture, to compress these fissures. So Rachel, what are the 4 A's of post-operative fracture assessment? Why don't you walk us through them on the radiograph?
Sure, Dr. Johnson. The 4 A's are alignment, apposition, apparatus, and activity.
Brilliant.
The alignment appears to be adequate, as the joints above and below the fracture are in correct anatomical position. The cortices of the proximal and distal pieces of the tibiotarsal fracture are also in good alignment, as just a small edge of the proximal tibiotarsus is seen to protrude farther than the distal tibiotarsus on the lateral and dorsoplantar views. The fibula was not surgically repaired as it is not a weight-bearing bone and will likely heal without compromising the function of the eagle's leg. The proximal and distal fragments of the tibiotarsus are in apposition, as there appears to be reduction of the fragments. The apparatuses, pin, plates, screws, and wires in this case, are secure in place and in proper position relative to the bone. At this time, no callus is present due to the acute nature of the fracture. The alignment of the bone ends in apposition, and the placement of the apparatuses are setting the bone up for primary healing. All of these parameters should be reevaluated at a later time before the animal is released back into the wild to see if the bone is healing appropriately. These structures should be able to withstand this animal's activity needed for the leg by the time it is released.
Sheer genius. After an uneventful recovery, Baldy the eagle was released.